My name's Tim Paul. I'm the CEO of the local ER group. I've been working here since 1998 in the emergency room. I got vaccinated for the first time I guess I was the third person in the county that got vaccinated. My experience with the vaccination was painless. The first shot was not bad at all. The second one, I had a little soreness in my arm, woke up the next morning and I felt great. So I really had no side effects. Protecting my community, I think, would be the number one reason. I think the argument I've heard over and over again about people that don't want to get vaccinated or are worried about it, there's two things. One is the side effects and the things that it might do to them. And I think the thing we really need to think about is we're doing it to help others. Most of us are pretty healthy. I'm at a very low risk of getting very sick from COVID, but I'm at a high risk of spreading it and giving it to other people and making them ill. And then we're utilizing resources that could be used for other people that need them, for heart attacks and heart bypass and hip replacements and appendicitis. Those beds have been utilized now for people that have COVID, and we're just seeing an overwhelming number of patients with COVID, and we really are struggling to keep up with that volume. We have tried to find available space to take care of the patients that we're seeing. We normally see during the busiest time of the year about 185 patients a day, and that would normally be in the winter during the flu season. We saw 240 Monday at Carrollton, and at Villa Rica, where we normally see 110, we saw 185. We have 30-ish beds at Villa Rica, and we had 55 people boarding. So we're running low on space, where if they were to get the vaccine, they're 30 times, not 30%, 30 times less likely to be hospitalized. And of the patients that are currently on ventilators, 95% of them in the hospital have not been vaccinated. So the folks that end up going to the ICU and being put on a ventilator, once that happens, their mortality, their risk of dying goes through the roof. And for the most part, it's unnecessary. It's a death that can be avoided. And I can't stress that enough. The treatments are nowhere near as good as the preventative medicine by a factor of 30. Personally, I think it's a no-brainer. There's a lot of disinformation out there, and a lot of people go on the internet, they get on Facebook, they go on, you pick it, whatever website they seek out, and all of a sudden everybody's an expert on infectious disease and vaccinations. I've been doing this for 23, I'm in my 24th year now at Tanner, and 8 years before I got here. And I don't know as much as the experts know. And when the folks that do this for a living are telling us that this is the best way to go, I tend to listen to them because they're not getting the vaccine. The virus continues to spread. More people end up in the ER, more people on ventilators, more people passing away.